Hi, my name is Daniel Gautier. I'm here to talk to the legislature about Bill 1458, which is being proposed by Tammy Green. We need to get the bus trips and grounds walks back because they were really therapeutic and they helped us with our treatment, and they only give the privilege of van trips and grounds walks to the highest level patients. So we're not proposing that everyone and anyone can go on these. It's just a very tiny population of the patients here at Western State Hospital that would be eligible for those. I'm really glad to get to talk to you today. I think that personally, I would benefit greatly from the grounds walks and the van trips. They would give me a breath of fresh air. They would help my meds work better. They would forward my drive to get a conditional release. And I really feel strongly that we should pass this bill. Thank you.
My name's Daniel Lybbert. I'm a patient at Eastern State Hospital. I've been here for 5 years. And I'd like to start by saying that I think it's very important for patients here to have the opportunity to put the skills they're learning here into practice, have the opportunity to test them out, and try out these strategies that we learn to cope and to recover in groups like going to a baseball game, in outings in a group, and feeling human, having human connections, being connected to the world, because this environment, without those outings especially, can seem very alienating. It's just the daily routine, and you don't have those opportunities to buy lunch, you know. And so I know I would feel a lot more comfortable about the prospect of reintegrating if I had opportunities to go on outings, had opportunities to put these things into practice, and to have human connections with the world out there. So I think those outings are very important for success, and that's what this is supposed to be about. It's supposed to be about rehabilitation, even more so than a Department of Corrections. This is supposed to be about rehabilitation, and I want to be successful out there. I want my peers to be successful out there. And I think that going on these outings and having therapeutic opportunities to put these life skills into practice is a primary importance for that to happen. That's why I support RCW 1077-145 to be revoked. Thank you.
Hello, my name is Ketema Lloyd Ross. I'm a patient at Eastern State Hospital. I'm 36 years old. I've been at Eastern State Hospital since I was 30 years old, so simple math tells you that I've been a patient there for the last 6+ years. And I'm here today to talk about why I think RCW 10.77.145 should be revoked as soon as possible. I did not come to be at Eastern State Hospital on any typical route, average route, any route that might seem like the way people end up in a state psychiatric hospital, but then again, nobody does. Myself, I started out a law student at Yale Law School, and my problems with mental illness really flourished, for lack of a better word, at that time. I did not have a diagnosis until I was 23 years old, and it was just after withdrawing, or around the same time I withdrew from Yale Law School, that I became, quote, mentally ill. To be fair, I was fully symptomatic at the time that I withdrew. However, I would like to add that I would not consider myself, quote, crazy, psychotic, mentally ill in the terms that are commonly used to describe people with mental illness, because I believe they're stigmatizing in a lot of the same ways that 10.77.145 seems to reflect this stigma, in that it takes away rights and privileges that I believe are a part of being an American citizen, not just reserved for people who fit into a certain mold of what normality is or should be. I would like to see 10.77.145 repealed because I've seen the impact it has had, not just on myself, but on the patient group that I'm surrounded by on a daily basis. This law, 10.77.145, has taken away hope from a group that already has very little hope to begin with. It might seem that the mental health care professionals that are in charge of providing treatment and or deciding when we're released are being lenient, liberal, not hard enough on us. It might seem that we've taken an easy way out from the Department of Corrections, avoiding the Department of Corrections, going to prison or an extended jail time, doing extended jail time. I want to let you know that this is not the reason I'm in the mental health care system. It's not the reason I'm in placement at Eastern State Hospital, and is not the reason that most of my peers are at Eastern State Hospital and or Western State Hospital or any other hospital nationwide. The reason that I'm here, I take that back. I'm actually on an authorized leave in Spokane right now. This is the first time I've been out in the last 6 years by myself. That is to say, unescorted. This isn't about me. I will get out of Eastern State Hospital. I will become a productive member of society again, and I will not reoffend, so to speak, in that I will not be conducting any criminal activity. I can speak for myself on that. I'm here, though, for the patients who can't speak for themselves, the patients who have been at Eastern State for 30 plus years, 20 plus years, 10 plus years, without hope. Those patients that this law, 10.77.145, has impacted the most. When you took away the reintegration groups, when you took away the ability to walk around the grounds, escorted or unescorted, you took away a lot of patients' hope, not just for someday regaining their sanity and participating in the community again. You took away their hope for life. You took away their reason for living. This is not to accuse anybody. I understand there are some very serious safety measures that have to be put in place. However, when you do that at the cost of taking away the very liberties that this country and the United States Constitution represent, you've taken away something that is precious, priceless, and absolutely should be restored. Thank you.
Hi, my name is Patricia Walters, and I reside here in Lakewood at Western State Hospital in the Forensic Unit F7. And I am here, my position is to support House Bill 1458. And also, I would like to say that I used to go on grounds walks, and that would help me a lot to de-stress. It helped me to exercise and relax and observe the natural environment around me. I was able to see what's offered me here on the campus at Western State Hospital, such as the library and the mail room, get familiar with things that are here, and I'm able to take advantage of the opportunity. Also, I used to go on van trips, and I achieved the highest level, which was 7 and 8. One time it used to be 8, it's changed. And I worked very hard for that, and it hurt me very much when I was no longer able to take those trips, because we lost the privilege, and they helped me to build trust in myself and staff and others. Also, the van trips helped me to prepare and budget, and it offered me the possibility of transitioning into the community and to expose myself for who I am, and that I am a person that is able to be trusted. And also, most of the time I've been here, the 13 years that I've been here, I've never assaulted anyone, and I've worked very hard. And also, it was wonderful when we were able to have out-of-building movements, and I'm very grateful for this time I've had to educate myself on my mental illness, which is bipolar. And also, I appreciate you taking this time to listen to me. And also, this issue, I hope it'll impact others, is it will be a stigma buster. And also, I'd like you to please forward this. Thank you very much.
Hi, my name is Jesus Martinez. I'm a patient at Eastern State Hospital. I have been here since 2000. I am in favor of revoking RCW 10.77.145, which does not allow us to leave the facility for outings and reintegration process. It's a very negative RCW, which impacts my life as well as others that are in this program or coming to this program or other programs alike in hospitals. And we'd like to do away with it. It takes away the hope that people have for recovery. It slows down recovery a great deal. And we need to do away with it to bring back the hope, programming, and recovery that people need to get back into the community. So help us do away with RCW 10.77.145. And thank you for your time.
My name is Santisteban. I am a patient on CFS at Western State Hospital. I've been here 13 years, and out of those years, I have been in level 7 for 7 years. I have enjoyed the times I utilized the level 7 bus trips and off the building movements. I look forward to the movements, anticipating shopping and eating at the mall and or venues along the way. It is worth working toward having the level 7 for off-ground privileges. There was the expectation that as a patient, I was held accountable to my security and the safety of others, both patients and staff alike. I proved to myself and the community that I am normal and I am able to associate in an environment free of danger and the stigma that comes with it. Thank you very much.
Hello, I'm Doug Harmon. I'm a patient here at Eastern State Hospital, found not guilty by reason of insanity about 4 years ago. I've been here. I've been diagnosed as bipolar stable, my disease in remission, and I'd like to see RCW 1077.145 be revoked because it stagnates us from reintegrating into society. We've gone up the level system, proved ourselves to the psychiatrist, and we're getting in the way of, this law is getting in the way of our reintegration because of politics and stigma, which Hollywood has expounded on in exploiting mentally ill people for really doesn't describe the way we really are, which is kind of boring existence of really normal most of the time. And so I'd like to see RCW 1077.145 repealed so that we can reintegrate into society in ways that are meaningful, even just to go visit a halfway house before we have to go to the halfway house would really be nice. Anyway, thank you for your attention.
My name is Jeff. I am a patient here at Western State Hospital. I was able to enjoy the privilege of being part of the Level 7 monthly van trips. I was able to enjoy such things as going to baseball games, going to movies, going to the park, going to museums. I was able to purchase such things as books, food, toiletries. The entire time that I was going on these trips was without incident. I really enjoyed the privilege and that I had earned and respected, and it was a great loss when we lost the privilege of those trips. I'm hoping at this time that you will consider passing House Bill 1458, and it would sure be appreciated. Thank you.
My name is Douglas Boyes, and I'm a member of the Sanka Party at Western State Hospital. And our objective is to repeal Bill, if I have this right, 1077.145, and to pass Bill 1458 to replace it. And so that we can have ground walks and van trips again in the future, which I feel are badly needed at this hospital because patients have been without these privileges for about, I would say, close to 5 years. And that's a long time to be, you know, locked in this hospital. And I feel that if we got our ground walks and our, especially our van trips back, that would give our patients probably just our level 7s, a sense of freedom, you know, and also would make them feel more like a normal person, you know, to have these rights, you know, to go once a month on a field trip, you know, outside, and it would give them, it would be good both for them and the community to have them out there together, you know, where they could interact, you know, and be among the community, and they would become acclimated to the community, and I think would give them some hope and optimism, and I think it would help them to obtain their CR quicker, and it would also help it would help to public opinion about the mentally ill. They could see that, you know, they are just as much normal people as other people, as long as they stay on their medication, and they watch themselves, you know, and they work on their treatment, and we have a wide choice of places we can go within about a 15-mile radius or so. We can go to any number of a wide choice of restaurants. We can go to, in the summer, we can go to Point Defiance Park, we can go to Sunnyside Beach, we can go to, probably go to maybe the Museum of Glass or Cheney Stadium, or maybe that new car museum that opened up a year or so ago. We can go to all kinds of stores, dollar store, the Walmart, and anyway, I want to say that I feel privileged to say that I'm very much in favor of Bill 1458. And thank you for allowing me to have the time to say so.